Lebanon's crippling financial crisis is having a disastrous effect on the country's hospitals. With the current drastic fuel shortage, the exodus of medical workers, and the lack of equipment and medicine, hospitals in Lebanon are fearing an imminent collapse. DW's Rebecca Ritters went inside Beirut's largest public hospital to witness the grim reality its staff and patients are facing.
On this COVID ward, the youngest patient is just 2 months old. The nurse gives him medication through a nebulizer to help him breathe. Nervous mum watches on. For the many patients here, this overflowing ward is their only hope. This man surrounded by a dozen others, all fighting for their lives.
This is one of 2 corona wards in the hospital. This used to be the ER room. Now it hosts only corona patients. The more critical ones go upstairs to the ICU. It's already at full capacity and the numbers continue to rise.
As I'm shown into the ICU, it's clear a COVID patient has just died. Yet it's not only the disease, the staff here are fighting to keep these patients alive. The machines that help them breathe could cut out at any moment. The ventilators are powered by these generators because the hospital can't rely on intermittent power from the state-run grid. They have only 3 days of fuel left.
The fuel is the challenge. It's a challenge every day. We have challenges every day. It affects the patients, the medical equipment, the chiller, the cooling. So the fuel is the most important thing in the country is the fuel.
The problems don't stop there. The hospital's general manager tells me morale is at rock bottom.
We are seeing a lot of doctors and nurses leaving. Yesterday alone, we had 5 resignations in our nursing department, and a senior physician also who's responsible for the radiotherapy program for our cancer patients informed me that they are leaving the hospital. So, these are not easy to replace.
Over in the hospital's pharmacy, the shelves are nearly empty. The government can no longer afford to subsidise imports of medicine, and supplies are running out.
We're hanging on by a thread. I think that, it's probably a matter of time before an accident happens, and then that can result in loss of lives.
As Lebanon's economy collapses, Firas Abiad fears without drastic intervention, the healthcare system will soon collapse along with it.
Let's get some more perspective on this story now. We can speak to DW's Bassel Aridi in Beirut. Bassel, can you explain to us why this hospital does not have access to power from the grid?
First of all, you have to know that Lebanon facing too many crises. First of all, the international community, when asked for reforms, on the top of the list was the electricity sector. The electricity sector in Lebanon cost the national budget around 50% of the national debt. We are talking about more than $47 billion in 25 years. So it's one of the most ailing and most corrupted sectors in Lebanon. So due to that, we're facing this power cut continuously. It's about 20 hours daily, this power cut. The most suffering sectors from that, of course, the hospitals. That's why we heard yesterday the call from the head of Doctor Syndicate. The DW office in Beirut received this letter, a copy of that letter. He's asking all the authorities, all the gas stations to make some gas stations as private for the doctors in order to reach the hospitals and do their job. Since in addition to what the report mentioned by our colleague Rebecca, we have to also know that the doctors are facing another critical issue, which is that they can't fill their cars' tanks with the gasoline.
We heard as well that fuel essentially is now the key to generate power in Lebanon. I mean, why is the fuel price also rising so much?
I'm now at one of the gas stations. As you can see behind me, some of these cars were parked in here since 4 days. And as you can see behind me, the owner of that gas station and some other guys from the local municipality are asking the owner of these cars to come to take it out from the gas station since they can't afford gasoline. So when we are talking about all these issues, we can say that one of the major problems that instead of the electricity sector, the monopolism. In the previous days, the Lebanese armed forces and other security forces, they seized millions of gallons. They were monopolized by some cartels. According to one of the MPs, head of the MP blocks in the parliament, he said in a speech from inside the parliament that Lebanon is facing or led by the cartel of the gasoline, the subsidy, the goods, and other medical issues. And he finished his speech by saying that maybe one day the Lebanese will wake up to see that the air that they are breathing is monopolized by one of the cartels as well.
Really is an astonishing crisis we're talking about, Bassel. What are authorities doing?
Absolutely nothing. I can say that it's nothing. They are just making some ministerial meetings and asking for the international community to help. But the international community, in order to help, he has certain conditions. First of all, to form a government that is able to do reforms. As I said, one of the main reforms is the electricity sector, and to negotiate with the IMF in order to help the Lebanese people. But instead, we can see that until this moment, after 10 months of the resignation of the current caretaking government, until now, the Lebanese authorities and the Lebanese politicians, they didn't have an act to form a new government. They are struggling from here and they're asking for this ministry or for that party or that party, as if they are living in state of denial, as the Lebanese local press mentioned and described the current situation. The Lebanese politician in state of denial.
DW's Bassel Aridi reporting for us there in Beirut. Thank you.